Hello nurses, welcome back to my channel. This is RN Sakshi. So in today's video, I'm gonna throw some light on a very important and a delicate topic which is known as cystic fibrosis. So this topic is extremely important kind of for NCLEX-RN as well as REX-PN. Why? Because sometimes there can be a health education question on this one and as well as case studies. So you should be familiar with general ideology behind this concept that you should be knowing for your exam. So let's get started. So what is cystic fibrosis in actual terms? So let me clear your confusion here. Cystic fibrosis is a genetic condition in which there is a faulty protein in your body which is affecting your whole body. Like ideally it is affecting your whole body, okay? Especially your pulmonary and pancreatic glands, right? So in whole body, I mean it can affect your tissues, glands, and body cells. So glands are responsible for producing mucus and sweat, right? So that's why it's affecting your glands. So, and especially your pulmonary and the pancreatic ones. So we can see that cystic fibrosis is a genetic condition. So it ideally deals with your CFTR protein, right? So we will see how the genetic thing works in this one. So I will be displaying the picture in the next slide. So in this picture, you can clearly see that father is the carrier of that gene and then mother is also carrier. So if you have studied in our +2 or +1 classes, we have discussed how the mutation works, right? So similarly in this picture, you can see 25% chances are of the unaffected child and 25% are chances for child with cystic fibrosis. So that contributes to total of 50%, but the major proportion of 50% contributes to the child can be carrier, right? So if the father is carrying a gene and mother is carrying a gene, there is 50% of overall chances that the child will born with 50% of the carrier gene, right? So sometimes in NCLEX there can be a question that there can be a scenario they can generate, like there is a father who is carrying this gene and the mother who is carrying the gene, the CFTR gene. So how you will educate the parents that what is the probability of child getting the cystic fibrosis gene, right? So same thing with this one. So 50% chances are with that the child will be the carrier of the cystic fibrotic gene, right? So this is like you don't have to study vast for this one, but you should know that how the mutation works. If you want, I can make another video that how the mutation is calculated. So we will read the definition of cystic fibrosis, which is enlisted on the screen. You can see. So cystic fibrosis is an inherited disorder, mainly affecting the pulmonary and pancreatic systems. Overall, it's affecting whole over the body, as I already explained in starting. This disease is an autosomal recessive genetic mutation on the CFTR gene. So what is CFTR gene? CFTR gene is responsible for your sodium and chloride channels affecting your body, right, and your organs as well, which can lead to further infections, obstructions, and inflammation. This will alter the lungs growth, structure, and functioning, and patient can have respiratory issues, right? So this is the definition of cystic fibrosis, which we are dealing with, right? So like if we are doing the physical examination, like what will be the assessments for these ones? So in respiratory, you can see there will be rhonchi and crackling sound and hyperresonance sounds. So these sounds are known as adventitious breath sounds. These are not normal, these are abnormal breath sounds, right? So what is like you can say like crackling sound. So crackling sound, when you rub your hair around this ear, so you will, the voice you will hear is the crackling sound. Or you have experience in daily life, like if you're eating oats, right? Like if you're eating oats and you pour a milk, so sometimes like when we keep them, there is a crackling popping sound, right? So that's your crackling sound, mainly the popping sound, right? And the crackle sounds are present when there is liquidified secretions over there or liquid mucus over there, then you can hear the crackling sound. And moreover, if we talk about rhonchi sounds are quite similar to wheezing stuff, and they will be heard best on expiration when you like breathe out. And the other thing behind that is they are coarse and they're very coarse and they're low pitched rather than crackles. The other thing if we talk about is that is hyperresonance, which we can see here, right? So hyperresonance means that air has been filled, like air has filled all over the space around the lungs, and lungs can or and it's prohibiting the lungs to expand. Like there is not much space for the lungs so that they can expand, right? So that is your hyperresonance. That is also an adventitious breath sounds. These three, rhonchi, crackles, and hyperresonance, are known as adventitious breath sounds. Adventitious means sometimes, they use these terminologies like adventitious. That means abnormal breath sounds. These are not normal at any cost, okay? So, and the other thing we can see in the physical examination in respiratory is nasal polyps. They are the non-cancerous growth which develop in the inner lining of the nose, right? So, and that can also lead to obstruction, and therefore as well as the breathing pattern will be altered in such conditions, okay? So that's the so to generate a clear ideology that how the mucus is affecting your respiratory canals, we can see in this picture that there is a normal healthy bronchus. There is no mucus obstruction in this one. So this is open airway. That means if there is no obstruction, right, it's a common sense that there will be good airflow. And if we talk about your cystic fibrosis, in which you can see that mucus is all over spreaded in the bronchi, so of course there will be obstruction and there will be respiratory obstruction as well, right? So there is a diagram over there that the trachea, then comes the lungs, and there is a bronchial tree, right? So that's why if there is mucus stuck of, or if there is any infection or obstruction in your bronchi, of course you will feel obstruction, and the mucus will get stuck over there, and there will be altered breathing patterns, there will be obstructions, right? And there will be excessive coughing, which can be noted in the cystic fibrosis patient because of course of the mucus, right? This is common sense, right? So these are some clear, or we can say the general ideology that you should know that what is the pathway behind it, right? So you should think critically, like, okay, if this is happening, then how it's affecting this system. Like if there is mucus, then how it's affecting our respiratory system. If there is mucus in the pancreatic system, how it's infecting our digestion, right? Now in this picture, I have already explained the airflow system, right? So now in this picture, we can see how the organs are affected by cystic fibrosis, because this should be also familiar to you guys if you are preparing for your NCLEX or REXPN. So sinuses, right? Because it can cause infection, right? Cystic fibrosis. So sinusitis, that is infection of sinuses. Okay, and lungs, thick sticky mucus buildup, bacterial infection, and obstructed airways. In the skin, the sweat glands will produce more the salty sweat, right? And then liver, of course, biliary ducts will be blocked because pancreatic system is also obstructed, so that's why. And if the pancreas are blocked, of course pancreatic ducts will be blocked. And intestines, you cannot absorb nutrients, right? There will be obstruction or problem in your digestion. And then reproductive, there will be issue in the puberty, and male and reproductive problems, male and female reproductive problems can occur as well. So there can be some complications. So they can like females can be infertile, right? And so there can be many problems related to these reproductive organs. So this thing has to be understandable, like this should be understood in a clear terminology, that like how it's not affecting only one system, it's affecting whole body in all terms. So now we will be briefly discussing about the how cystic fibrosis is being diagnosed. So first is, you can see prenatal screening. This is a genetic test that collects DNA of the fetus through amniocentesis or chronic villus sampling, right? So this I will make a separate video on these two diagnostic tests, which will be used in your maternity as well. The other is your newborn screening. This test is conducted with the first few days after birth and usually involves the genetic analysis after a positive immunoreactive trypsinogen test. So just learn briefly about this, that we have to do the newborn screening, and we have to see that if there is a immunoreactive trypsinogen test which is positive, that means the child can have cystic fibrosis. The gold standard test which we do to diagnose cystic fibrosis is sweat test. So what you can see videos on YouTube as well. There are many videos on this one. So this test is gold standard in cystic fibrosis diagnosis and measures levels of chlorides in sweat, which are abnormally high in CF patients. Okay, so they will be very high, extremely high in cystic fibrosis patients, and that can channelize that maybe that baby or that child has cystic fibrosis, because as I have already told you that CFTR protein is abnormal, which is responsible for sodium and chloride maintenance in your body, right? So that's the gold standard test which we do. Moving forward with the other one is nasal potential difference. This test detects abnormalities in small electrical charges in the airway lining inside the nose. So of course, sometimes docs can see through this testing that if there are any nasal polyps, right, or any growths which can be seen in the nose. I have already mentioned that there can be nasal polyps which are non-cancerous growths. That can be also signifying cystic fibrosis in some cases. Then the other test which we can consider here is imaging test of lungs and other bodily structures. Of course, if there will be some CT scans can be done, right? So sometimes they can show that like there is any obstruction or any abnormality in maybe pancreas, the respiratory thing, right? So lung function assessments we have to do, and sputum cultures to detect infections, of course. So how we will detect the infection if the client is suffering from any infection? Of course, sputum culture will be done to rule out the infection, and then stool analysis to evaluate digestion. So the one major thing which I would like to reflect here is that steatorrhea. So in cystic fibrosis clients, steatorrhea will always be present in such conditions. So I will just write it down here for you guys. Like I will show you that what steatorrhea is, which is very useful for your NCLEX-RN. So here you can see that it's a steatorrhea is a medical term for fat in stool. Like there is enormous amount of fat in stool. So fat in stool can cause bulky stool that floats and has an oily or greasy appearance, right? And it smells foul. So fat is the stool, fat in the stool is the fat that digestive tract was unable to absorb. Remember, in the symptoms we have discovered that there can be hepatosplenomegaly, and if there is liver cirrhosis, so hepatosplenomegaly will be present in cystic fibrosis patient. Why? Because their intestines cannot absorb properly the nutrient thing, right? So that's why if the fat is like the cystic fibrosis patient will have an issue related to the fat absorption. That's why their stool will be very bulky and frothy. So this is due to that malabsorption of the fat, right? So this thing sometimes it's straightforwardly come in SATA, that what are the signs and symptoms of cystic fibrosis. So you should know that what steatorrhea is, right? There can be a health education question as well, that the nurse have to educate about the major symptom of cystic fibrosis. So steatorrhea, right? So sometimes in the layman language, sometimes we have to tell to the family members that what this term actually is and what problem they can see in the cystic fibrosis child. So these are some terms which you should be always familiar, right? So okay, so now let's discuss about what will be the sign and symptoms and chief complaints of the patient with cystic fibrosis. So first and foremost, of course, salty tasting skin. Like there will be more sweat produced by your skin. So of course the skin will be very salty. If you will see the sweat, that will be very salty as well. There will be persistent cough as of the obstruction in your respiratory glands, as well as we have discussed about the path, so that there is mucus and that can lead to obstruction. So of course persistent cough, frequent lung infections of that mucus and secretions, and wheezing, bronchi, crackles, and hyperresonance. These all are the adventitious sounds which are abnormal breath sounds, right? So wheezing is like whistling sound, high pitched whistling sound, right? So next we have is your shortness of breath as of course of the obstruction. See, like if you know the pathophysiology, then you can see that how the sign and symptoms can be correlated. You don't have to cram anything, right? And if there is a question in your NCLEX exam, then you can automatically correlate the sign and symptoms as well as the treatment, the drugs, right? So what can be dealt with that particular situation. So these are some tricks, and these were all about your symptoms, and same you can relate with your. Okay, now let's discuss about the diet for the cystic fibrosis patient. So what diet you think we can give to the client, right? So of course high calorie. Why high calorie? Because of energy, right? So for energy our body needs fuel, which will be coming from our calories. So high calorie and high fat diet. Why high fat? Because the client is already eliminating excess enormous amounts of fat. Remember steatoria? So that's why we have to give them high fat, like not the saturated or that kind of fat like cheese, which comes from cheese, bacon, or we can say like butter, ghee, oils, right? So sausages or salami. So that can be also a health education question. So we have to give them good amount of fat, and like the and we have to always prescribe them that they should not have salt. Why? Because of excess chloride and salty sweat and skin. No added sugars. They should be dependent on leaner proteins, right? So they should not consume red meats at any cost, because it's also of the saturated fat. It comes in that category. And then we have to also tell them that you have to eat whole fruits, whole grains, vegetables, green leafy vegetables, like that kind of stuff, right? So these are some diet considerations which we should tell to the. Okay, now let's discuss about the diet for the cystic fibrosis patient. So what diet you think we can give to the client, right? So of course high calorie. Why high calorie? Because of energy, right? So for energy our body needs fuel, which will be coming from our calories. So high calorie and high fat diet. Why high fat? Because the client is already eliminating excess enormous amounts of fat. Remember steatoria? So that's why we have to give them high fat, like not the saturated or that kind of fat like cheese, which comes from cheese, bacon, or we can say like butter, ghee, oils, right? So sausages or salami. So that can be also a health education question. So we have to give them good amount of fat, and like the and we have to always prescribe them that they should not have salt. Why? Because of excess chloride and salty sweat and skin. No added sugars. They should be dependent on leaner proteins, right? So they should not consume red meats at any cost, because it's also of saturated fat. It comes in that category. And then we have to also tell them that you have to eat whole fruits, whole grains, vegetables, green leafy vegetables, like that kind of stuff, right? So these are some diet considerations which we should tell to the good fat. We can tell them that you should eat whole eggs. They can eat nuts. They can eat fatty fish. They can eat extra virgin olive oil or full fatty yogurt, right? So these can be some tips for the clients who are taking the full fat diet. And they can also take milk, okay? And so some amount of butter can be negotiated, but not the if they're taking the salty ones, right? Like they're eating chips or some snacks, right? And some fried foods. So that kind of stuff you should remember for your general knowledge. And then now we will be talking about the ongoing care and general measures. So routine visits every 3 months, like frequent visits, and the annual evaluation, nutritional evaluation, that how they are eating, what is their balanced diet, annual influenza vaccine. Why? To prevent the reoccurrence of the infections like common cold and rhinovia, like that kind of infections. Then we have to, of course, this is common, that we have to encourage them that do not get exposure to the tobacco or smoke, as because of vasoconstriction, and they will be having more breathing abnormalities or problems, and it can also lead to the obstruction, and that can cause more complications for them in the future. Other thing, we can also educate the clients here that they have to take small frequent meals, like 6 small servings in a day, so that they cannot put increasing pressure on their digestion, right? The other thing, for the medications, antibiotics are prescribed by the doctors for the pulmonary infection in the cystic fibrosis client. And along with the medications, we can do chest physiotherapy to loosen up the secretions, and they can expectorate those secretions. And then we can also like sometimes doctor can prescribe some surgical procedures like bowel surgery or lung transplantation. And so yeah, nutritional therapies can be beneficial in such clients. So this was all about the cystic fibrosis. I hope you have a general ideology or concepts, or I tried to clear your concepts that how this condition affects our whole body. So rather than getting confusing like pulmonary or pancreatic, most commonly it affects these glands and organs, but it is mainly affecting whole over the body. So create a clear picture in your mind that mucus secretions are getting stuck in your body. So how that mucus secretions will deteriorate your body and your organs and glands and their functioning. So that can be very beneficial for your NCLEX-RN or REX-PN. So try to do self-study on these topics and do practice questions.